Dr Mzukisi Grootboom. Dr Grootboom, good afternoon to you. Thank you for your time. Today, I'm sure you're aware of what the Archbishop has said about wanting to choose his own way of dying. What do you make of his comments?
I think with the current legislation and the current constitutional right that everybody has got a right to life and a right to deciding how they want to end their own lives, would accept that, but there must not be an expectation that doctors will be part of that decision. And it must be made very clear that it is unethical to either assist or to be part of a decision for a patient to take his life. Doctors are not supposed and are not trained to kill. Doctors are supposed to heal and alleviate suffering. That's the context under which we function currently in the South African dispensation.
Those who support Dr. Grootboom, those who support assisted suicide will use the last part of your sentence possibly to argue that by doing this, if it was to be passed into law and decriminalized, that doctors will be ending suffering.
Well, the most important thing is that when the possibility arises that anybody's illness or injury is going to lead to long-term sutterings, there are certain steps that the doctor needs, together with the patient and his family, to start taking steps and prepare to prevent the actual suffering that the patient is supposed to go through. And not wait and say, we're desperate, let's end this person's life. There are mechanisms to deal with that problem. There are guidelines that are very clear from various quotas, including the World Medical Association, to which, as an association, we've affiliated to. I know and understand that there's various cries across the world, not only in South Africa. This is a debate that is going on worldwide. And I can assure you that it is being looked at, and having discussed it in the last World Medical Association meeting, I'm talking about April this year and October last year, the overwhelming majority of medical associations in that meeting was that, given the history that most countries have gone through, and the reason why we set up those organizations is precisely to emphasize the ethical role of the doctor. Very, very important. We also are not saying that patients should be allowed to die in an undignified way. Again, I want to repeat, the decision must be taken long before you get to the desperate situation. You prepare the patient, you prepare the family, and the state, and even the private funding industry, it should make sure there's adequate access to palliative care and to deal with those eventualities.
Dr. Grootboom, thank you very much indeed for speaking to us. SA Medical Association chairperson.